All right, raise your hand if you deal with headaches, fatigue, a stuffy nose, or sinus pressure from time to time. Maybe you deal with it nearly all the time. Well, there's a new advanced treatment out there that really could change your life. We're going to hear about someone whose life was changed here in just a moment. Here to tell us about it is Dr. Gould, the medical director of the St. Louis Sinus Center, who completed his residency, by the way, in our backyard at Washington University Medical Center, which is like a mecca for this kind of stuff. Along with Dr. Gould is one of his patients, Cynthia Emily, has gone through this procedure. Welcome to both of you.
Thank you. Thanks for
Dr.
having
Gould,
us.
welcome back to you. So talk to us about sinusitis. How big of a problem is it in this country? How many people are affected?
Well, sinusitis is huge. It's about 37 million patients in the country, in the U.S., are affected. So that's over 10% of the U.S. population. So it's a huge problem in the U.S.
Cynthia, you were a part of that problem, and you dealt with this for years and years and years. Tell us what kind of symptoms you were living with every day.
Right. For probably over 20 years, it was chronic sinus congestion, drainage, headaches, fatigue because you don't sleep well, medications, antibiotics, oral steroids, just on and on and on and on.
It just kind of dips into every part of your life. So, doctor, why does it happen to people like Cynthia and 38 million Americans a year?
Yeah, so sinusitis is basically a chronic inflammation of the sinus cavities, so the areas that surround the nose, and those areas get inflamed and swollen, and it basically blocks the natural opening to the sinus, and that basically leads to all the symptoms that Cynthia had: congestion, facial pain, pressure. Interesting, a lot of patients don't even realize that their symptoms are chronic sinusitis, so it's important to get an evaluation to figure that out.
People want that evaluation, and then they want to know, what are you going to do to help me out? And this little tool, we were just talking about this during the break, it seems like it ought to be so much bigger. This is what you use in this new balloon sinuplasty procedure, right?
Right, exactly. This is it. It's very simple. It's a little device. It's a catheter, and it has this little balloon on the end. And you insert the catheter into the patient's nasal passage and inflate that balloon like that.
See, the liquid just went into it. Okay.
Yeah, and you just leave that up for about 3 to 4 seconds, and then you deflate the balloon all the way, and then you take it back out and you're done. Wow. So it basically dilates the sinus opening without going in and surgically removing any tissue, so our patients are back to normal activity the next day with a great result.
We've got an animation of this that we can show folks at home too to try to give them a better sense. So I see that instrument you just showed us going into the nasal cavity.
And this is showing the device in the frontal sinus and all the infection there. The balloon is being inflated and it's dilating the sinus cavity. And we can also suction the sinus out through this device and also irrigate the sinus if we need to.
So it just forces that opening to get a little bigger.
Exactly, and it permanently remodels that bone. So, you know, people ask, do I have to have this done over and over again? Right. And the answer is no, because the bone actually is remodeled or dilated. So it's really a permanent 500% surface area increase in the opening. So
that's big. So Cynthia, you went through this process. What was it like as this stuff is going up your nose? It seems like it'd be a weird sensation.
It's not bad at all. It really isn't. Prior to the procedure, I was given a very mild sedative and some pain medication. I was actually fully alert and remembered the procedure the entire time. Dr. Gould spoke with me and explained every step of the way. My nose was numbed, so before he would dilate the balloon, he would tell me what was going to happen, and again talk me through it. I would feel pressure, but honestly there was no pain.
And the changes have been phenomenal, it sounds like.
It's been over a year, and I haven't had to be on antibiotics for that whole time.
How about that? And somebody that suffered with it for a long, long time. Thank you both so much for being here. I feel like there's a lot of people watching, especially this part of the country, that could benefit from this. It's the St. Louis Sinus Center, and it's a national center of excellence, which basically means Dr. Gould's peers travel there for training on this balloon sinuplasty from across the country. If you're ready to end your sinus suffering, get in touch with the St. Louis Sinus Center. There's the number right there, 314-4RELIEF. That's 314-473-5433. Or check them out online at www.stlsinuscenter.com. Virginia?
I think I could use that.
I know, I was thinking the same thing.
Yeah, because you have to listen to me all the time.